Hi everyone, Dr. Alisa Kauffman here with Dr. Terry Grant from Suffolk County, New York, and our topic is going to be extractions. You know, people think that you need to have all this equipment to do it safely in the home. So I'd like you to describe how you safely do it in the home.
Well, I visit your facility. I have
Or
everything.
home.
Or your home. Everything is packed. It's hygienically clean through my staff. I lay out a separate area that's nice and clean. I go in, make you numb, and I have a technique that I use for anesthesia where a lot of times patients don't even know I made them numb.
I love that.
I go in with the mirror.
Love that.
I go in with the mirror and I go behind the mirror, and the patients go, I didn't even think you injected me. And I said, yes, I did. But I'm getting numb already. Well, that's the technique. And so we utilize the same technique. We go in. Once you're numb, I wait for 10 to 15 minutes. I don't rush in to provide the service. So we put anesthesia to work. We're not in a hurry. We're not in a rush. When anesthesia, make sure you're nice and anesthetized. But then we go in with my technique that I train a lot of my students at the university how to use. And we go on my technique and boop, the tooth is loose. Yeah. It's just that easy.
Wow. You know, when you know what you're doing, you know what you're doing.
People say, oh, it's going to take forever. And I sit there and say, not even 10, 15 minutes.
Wow.
It's in my hand.
Once you're numb, it shouldn't take you
and
long,
then
right?
and then I'll sit there. And it's funny because I'll sit there and go, okay, I put the gauze in. I said, you're going to sit here. I'm not finished yet. So you're going to sit there and go, we're not finished. I said, oh, but here's your tooth right here.
I know, I love to do that. I love the tricky part. Like when I say, are you ready to do it now?
Are you ready now? Yeah.
And they're like, I think so. And I'm like, here's your tooth.
Yeah,
I love it, I love it.
Yeah.
So I love doing extractions. I wish that's all I did, honestly. That's like my favorite thing in the world to do. So we go in there safely with our sterilizable pouches, like we would in our office. We open them in front of you. It's very safe. We know what we're doing. And there are times, right, that we won't do that extraction, but hopefully we know that before we get there. If it's a very high-risk patient and they've had many issues in the past with extractions, we will say you need to go to the hospital, or you need to go to the oral surgeon in the hospital. Have you ever gotten a call from someone and you've looked at the picture and the face is so swollen that you tell them to call 911, skip your...
Yes, that's important to me. Because now that you called me, I'm responsible for you. And I take that responsibility very, very highly.
Yes. So if we see a patient that's extremely swollen and we think it's gone too far, where we know they need IV antibiotics, we don't even bother to come to your house and charge you to tell you that. It's a free call. We want you to go to the hospital and be well.